Do you ever walk into a room and suddenly forget why you went there, or can't remember where you left your keys? Today I want to talk to you about a problem that worries so many people: frequent forgetfulness, and more importantly, how you can start protecting your memory with very concrete actions beginning today. I am Dr. Gabriel Mina, and there is something important I want you to know. Memory problems do not appear overnight without warning. The body usually sends silent signals, small alerts that we often ignore, but that can make a big difference if we learn to recognize them early. Welcome to my channel. Here we talk about holistic health, longevity, and natural, very simple habits that help you maintain physical, mental, and emotional balance. Take note and share this information with your family and friends so they can also improve their health. We upload new videos every day, so subscribe and turn on notifications so you don't miss any of them. Before we continue, if you find this content valuable, a simple gesture like liking the video or sharing it helps this message reach more people who truly need it. Thank you from the heart for being here and for taking care of your health. Now let's get into today's topic. Memory does not depend only on age. It is strongly influenced by nutrition, sleep, stress, and how your brain eliminates the waste it produces every day. When this process fails, those forgetful moments begin to appear, and at first they may seem harmless. You may relate to this. You are about to say something and suddenly the thought disappears, or you ask yourself, what was I going to do? Sometimes it can be fatigue or worry, yes, but when these lapses happen frequently, they are a warning sign that should not be ignored. One of the earliest signs I see in my practice, and one that very few people know about, is a loss of the sense of smell. I am not talking about a cold or a virus, but about gradually stopping perceiving odors without a clear cause. This can be an early sign that something is not working properly at the brain level. Here is something essential to understand. The brain uses about 20% of the body's total energy. That means it works intensely and, like any powerful engine, it produces waste. The problem arises when that waste is not eliminated correctly. When that happens, repetitive forgetfulness begins. Why did I come here? Where did I put this? What was I going to tell you? At first they are small lapses, but over time they can become more frequent and start affecting daily life. Our brain has a special cleaning system called the glymphatic system, which is responsible for removing this waste. For many years, it was not even known to exist. This system works mainly at night, while we are in deep sleep. Although the brain is also active when we dream, especially during deep sleep phases, it is during the early hours of the night that this internal drainage system opens and clears out the toxic substances accumulated during the day. If you go to bed very late or sleep poorly, this system cannot do its job properly. When this happens night after night, waste remains in the brain, and problems with memory, concentration, and mental clarity begin to appear. Many patients tell me, "Doctor, I wake up with a heavy head, it's hard for me to think." That is not a coincidence. It is a sign that the brain did not clean itself well during the night. That is why I always recommend looking at something very simple. What time are you going to bed? The first hours of sleep, before midnight, are fundamental for brain health. It is not just about sleeping, but about sleeping at the right time. I say this with care and clarity. Going to bed early is one of the best decisions you can make for your memory. Ideally between 9:30 and 10 p.m. If you have to work, it is better to wake up earlier than to sacrifice those critical hours. Sleeping poorly for one night will not cause serious harm, but doing so consistently does increase the risk of cognitive decline and memory problems over the years. I see this often in people who work night shifts for long periods of time. I remember a patient I treated, around 62 years old, who began experiencing daily forgetfulness. It was not a lack of intelligence or interest, it was simply that he went to bed very late every night. We adjusted his sleep schedule, and within a few weeks he himself noticed how his memory improved. Later on, we will also talk about the role of medications, melatonin, and how to differentiate normal stress from a real memory problem. But I want you to hold on to this first key idea. Going to bed early is a powerful tool to protect your brain. If this information is helping you, consider continuing with us on this channel. Here we share practical content designed for your well-being. We will continue in the next segment, because there is still much more you need to know to care for your memory in a simple and effective way. If you are dealing with frequent forgetfulness and feel that your memory is no longer responding the same way, I want to tell you something very important. Before thinking about medication, there are two fundamental steps that can help you tremendously. The first is improving nighttime rest, and the second is helping your brain eliminate the waste that accumulates every day. I am Dr. Gabriel Mina, and I see this again and again in my practice. Many people come in worried about their memory, and the first thing they ask about is sleeping pills. But the evidence shows that, in many cases, they are not the solution. I suggest something simple and very effective. For 1 week, try this. Set an alarm for 9 p.m. When it goes off, turn off the bright lights in your home and leave only warm, dim lighting, such as a soft lamp. 1 hour later, go to bed. Do not try to force sleep. Just prepare the environment. Sleep cannot be forced. The body needs clear signals to relax. This small change helps the brain understand that it is time to rest. I have seen patients who were able to stop taking sleep medications simply by applying this habit consistently. In addition, moving your body during the day, doing some physical activity, and staying emotionally active greatly support better sleep. Balance between body and mind is essential for good rest. Now let's talk about something that directly affects memory: alcohol. You need to know this clearly. Alcohol is toxic to the entire body, but especially to the brain. Even in amounts that seem small, it can damage neurons and affect memory over time. Regarding sleep, many people ask me how many hours an older adult really needs. Ideally, between 7 and 9 hours, although it is normal for sleep to be more fragmented. It is not just about quantity, but also about quality and consistency. Now I want to move to a very important part of today's topic: nutrition that protects your memory. When the brain works intensely and cannot properly eliminate waste, toxic substances called free radicals are formed. These damage neurons if they are not neutralized in time. This is where certain foods with special properties come in. Some have the ability to cross the protective barrier of the brain and act directly where they are needed, reducing inflammation and cellular damage. One of the foods with the strongest scientific support is blueberries. They contain compounds called anthocyanidins, responsible for their deep blue color. These substances can cross the blood-brain barrier and reach areas related to learning and memory. Simply put, it is as if the brain receives an internal cleaning exactly where it needs it most. This is not a miracle pill, it is real food backed by science. I always make this clear in my practice. I do not sell supplements or magic products. I talk about food. A small cup of blueberries per day, or even less, is enough. They can be fresh or frozen. Dried blueberries can also be used, but with caution in people with diabetes due to their higher sugar concentration. I remember a 68-year-old patient I treated who came in worried because she was forgetting simple things. We adjusted her sleep schedule and added daily blueberries. After a few months, she herself noticed greater mental clarity and better concentration. It was not magic, it was consistency. Blueberries help because they clear away the waste products left behind by the brain's daily work. Keeping this space clean allows neurons to function better and helps prevent memory from deteriorating prematurely. Studies even show that a diet rich in these compounds can help prevent and delay brain changes associated with aging. However, when Alzheimer's disease is already advanced, the damage is difficult to reverse. That is why acting early is so important. If you have a family history or are already over 50 or 60 years old, do not wait. Going to bed earlier and paying attention to what you eat can make a huge difference. These recommendations also apply to children. Sleeping too little affects not only physical growth, but also cognitive development. The brain needs deep rest in order to grow and learn. In addition to nutrition, the brain benefits greatly from learning new things. Board games, puzzles, chess, learning how to use a smartphone, or any activity that mentally challenges you helps maintain brain plasticity. In the past, it was believed that the brain could not regenerate. Today we know that if you keep it clean, well-nourished, and stimulated, it can improve its function even as the years go by. In our lifestyle medicine programs, I have seen remarkable improvements in people with mild cognitive impairment, diabetes, or hypertension. When good habits are combined, the brain responds. Poor sleep, poor nutrition, and lack of mental stimulation accelerate the problem. Sleeping well, eating better, and learning new things slow it down. In the next segment, we will close this topic with very important final recommendations to protect your memory and long-term well-being. If you are worried that your memory may be failing, those small forgetful moments that repeat and make you doubt yourself, today I want to help you understand how to care for your brain and which simple habits can make a real difference, even when there are already early signs. This topic is key to protecting memory and slowing cognitive decline in time. Many people ask me whether someone with diabetes can consume blueberries or grapes without risk. The answer is yes. Berries, especially blueberries and black grapes, are among the fruits with the lowest sugar and fructose content. If someone tells you that blueberries are harmful, it is truly worth questioning that opinion, because we are talking about natural foods with scientific evidence supporting brain health, not desserts or ultra-processed products. The most recent studies show that Concord grape juice, that dark, almost black-purple grape, can improve cognitive function in older adults with early memory decline. This is not an isolated finding. Researchers compared people who consumed grapes and blueberries with others who received something similar but not these fruits, and the difference in memory was significant. This opens the door to a better understanding of how these foods act within the brain. I want to share something I consider fundamental. It was published in a serious scientific neurology journal. Researchers analyzed the relationship between the consumption of berries and flavonoids and cognitive decline. They do not talk about pills or miracle supplements, they talk about food. They found that a higher intake of blueberries and strawberries, rich in anthocyanidins, is associated with slower cognitive decline. In simple terms, it is as if the brain's age stays 2 or 3 years younger compared to people of the same age who do not consume them. Imagine being 80 years old and having the memory of someone who is 77. Now, a very common question is how much should you consume per day? The practical recommendation is about 100 grams, roughly what fits in the palm of your hand, of both blueberries and black grapes. You can add them to oatmeal or prepare a smoothie, but always use the whole fruit, including the skin. In the case of grapes, there is something very important. Do not remove the skin or the seeds. Chew them. That is where resveratrol is found, a very powerful antioxidant. I say this clearly. One grape or a handful of blueberries contributes more to brain health than many pharmacy vitamins. I always tell my patients that what God created in nature is irreplaceable. No pill can truly mimic the complete effect of a whole food. I remember a patient around 72 years old who came to the clinic very worried because she was forgetting appointments and names. We started with simple changes: better sleep, less sugar, and blueberries every day. Within a few months, she told me herself, "Doctor, my mind feels clearer, it doesn't happen as often anymore." That is what we are looking for, real, sustainable improvements. It is also important to clarify something. Memory loss is not the same as amnesia. Amnesia is usually temporary. Memory loss is more persistent, reading something and forgetting it, hearing something and not retaining it. If that happens frequently, do not ignore it. Start today with these habits: blueberries and black grapes on a regular basis. Another common question is whether eating fruit at night raises blood sugar more. Evidence shows that the pancreas works better in the morning. At night, it is more fatigued, and the same amount of sugar can raise glucose levels more. That is why it is best to consume these fruits in the morning or at midday, not before going to sleep. Many people ask whether they can take resveratrol or antioxidants in pill form. Science is clear. There are not enough studies showing that isolated compounds work the same way as whole foods. In fact, it has been shown that whole blueberries are more effective than their individual components. The whole is greater than the sum of its parts. That is why I insist, do not spend money on memory supplements when you have blueberries and black grapes within reach. Regarding other types of grapes, the study is clear: black grapes, specifically Concord-type grapes. Can they be given to children? Yes, absolutely. And if someone has diabetes, we are talking about 100 grams, not excess amounts. Many times people fear a natural fruit, yet consume processed juices or sweetened dairy products without concern. Everything must be put into proper context. So, To summarize, the key players here are the anthocyanidins found in blueberries and black grapes. And I want to close with something deeper. Memory is not only biological. A special date is approaching, and speaking of memory, I like to remember that God does not forget us. There is a beautiful passage that says that even if a mother could forget her child, God will never forget you. If you are here today listening to this message, it is because He has you in mind. This is an invitation to give thanks, to be grateful for life, for the knowledge that allows us to care for our health, and for every opportunity to improve. Be grateful even for difficulties, because many times they help us grow and refocus on what truly matters. If this content has been helpful to you, I warmly invite you to subscribe to the channel, share this video with someone who may need it, leave me a comment, and activate the notification bell. We upload videos every day, always thinking about your well-being and about walking alongside you on this path of caring for memory and health. On this Dr. Gabriel Mina channel, we are very happy to contribute to your health and help you improve habits in a practical and approachable way. Tomorrow there will be a new video waiting for you, and hopefully we can continue walking this journey together. Thank you for being here, for taking care of yourself, and for trusting us.